Today, we're going to gain an understanding of the effects of American healthcare legislation on HIV positive patients.
Prior to Obamacare, the United States had 52 million people uninsured, and this was the worst out of the 31 most developed countries in the world. And Obamacare was seen as sort of a necessary compromise. So on March 22nd, 2010, Obamacare was signed into law through reconciliation process, which is a majority vote instead of 60 votes by tying it to the budget bills.
Obamacare can be a particularly difficult law to understand, and the best way to break down this policy is into three parts, beginning with insurance reform. Insurance reform ended discrimination against those with pre-existing conditions, which was a major win for those who were HIV positive. Prior to this, insurance companies could either deny individuals coverage based on pre-existing conditions or simply charge them significantly more. This happened often to those who were HIV positive. The law also banned recessions, which is pulling back insurance that people really used, most commonly used against breast cancer survivors. And the final piece of insurance reform was to end lifetime caps and annual caps. These caps allowed insurers to stop paying at certain points. The majority of people who went bankrupt in the United States were people who ran out of their insurance because of these lifetime caps and annual caps.
The next part of Obamacare is increasing access to care. Obamacare allowed children under 26 to stay on their parents' plans. This was hugely popular with both parents and their children, and late Republican adjustments to Obamacare would keep this in. It also allowed all poor people access to health care, not just women and children, which was previously what Medicaid was for. The Supreme Court ruled that states did not have to accept money from the government to expand Medicaid, and Florida and Texas both opted to not enact this policy. This left 4 million people uninsured, and this also left a donut hole where people who did not make enough money to be covered by Obamacare and made too much money to be left on Medicaid did not receive insurance.
The final aspect of Obamacare was the insurance exchanges. President Obamacare described this part of the policy as creating the Travelocity of healthcare. This turned out to be not quite accurate. This led to a significant amount of problems later on, which will be addressed later on in this presentation.
Obamacare and the HIV positive community. Outside of private insurance regulation, Obamacare provides insurance for tens of thousands of patients with HIV who were without care prior to 2012. The most important aspect of Obamacare for HIV positive individuals is the non-discrimination policy against people with pre-existing conditions. Prior to Obamacare, HIV positive individuals would either be denied coverage or charged an exorbitant fee because of their disease. Obamacare now made this illegal, giving these patients access to equal care. Another major aspect of Obamacare that helped HIV positive individuals was the option to stay under their parents' care until the age of 26. In 2015, 1 in 5 individuals diagnosed with HIV were aged 24 or under. The expansion of Medicaid to poor men gave access to a significant amount of HIV positive patients. Gay and bisexual men are the largest demographics infected by HIV, and this Medicaid expansion was particularly impactful in this community.
As anyone who watches the news is aware, Obamacare had a lot of issues. The problems began with the insurance exchanges. To understand the problems with the exchanges, it is necessary to understand 4 major healthcare terms. First is the premium. The premium is how much the consumer pays the insurer each month. Next is the copay. The copay is what the consumer pays directly to the doctor when going for a visit. This is prior to the insurer picking up the cost. The other option, instead of a copay, is the coinsurance. This is similar to the copay, except the consumer pays a percentage of the cost instead of a fixed fee, as it would in the copay. Finally is the deductible. The deductible is where the coverage starts after the consumer pays a certain price. For example, the consumer would have to spend $200 on healthcare before the insurer started picking up costs for that year.
It is important to understand that cheaper premiums lead to higher deductibles, and an affordable program has low deductibles. A significant amount of people choose low premiums, but their healthcare had high deductibles and then didn't get insurance until they've spent a large amount of money. A major problem under Obamacare was people choosing cheap premium, high deductible plans because they were uneducated about the topic.
Obamacare also mandated that all Americans have health insurance by implementing a tax penalty. Many Republicans took issue with this. However, in many cases, the penalty for living without healthcare was less than the cost of the healthcare. Many individuals deemed the difference was enough to take the risk of living without healthcare. Therefore, the population that signed up for Obamacare was significantly sicker than expected. This sicker population made it necessary for extremely high premiums, so the healthcare tax mandate failed to achieve its purpose of keeping premiums low.
Under attack. Republican politicians jumped on the flaws in Obamacare quickly, most notably our now President Donald Trump. High premiums served a major talking point for Republican candidates during the 2016 campaigns and resonated with a large portion of Americans who were directly affected by this issue. Eventually, Trump would be elected with a majority Republican House and Senate. They would immediately go to work to take down Obamacare.
The first attempt at repealing the Affordable Care Act was the American Health Care Act. The major differences include eliminating the individual mandate, giving states the option to eliminate the ban on discrimination against pre-existing conditions, and phasing out the Medicaid expansion. Parts 2 and 3 have a dramatic negative effect on the HIV community. As we saw earlier, the most important aspect of Obamacare for the HIV-positive individuals is the non-discriminatory policy against people with pre-existing conditions. Prior to Obamacare, HIV-positive individuals would either be denied coverage or charged an exorbitant fee because of their disease. Obamacare now made this illegal, giving these patients access to equal care. The AHCA threatened to rid these HIV patients of this major step forward. Another major impact comes from the phasing out of the Medicaid expansion. Because of the demographic for HIV-positive patients, the phasing out would include the poor men that gained access to equal care through Obamacare. This would be particularly detrimental to those who are HIV positive. The bill would ultimately fail, as it cannot receive the necessary votes in the Senate and Congress, and the Republicans would have to retry. Their next attempt was the Graham-Cassidy bill.
Led by Senators Lindsey Graham and Bill Cassidy, the second attempt to repeal Obamacare was aptly named the Graham-Cassidy bill. Unfortunately, it had all the same detrimental effects to the HIV community as the first. It allowed health insurers to charge higher premiums to people with pre-existing conditions such as HIV, eliminated Medicaid expansion, eliminated health insurance mandate, and lowers premiums by allowing individuals to buy high deductible plans.
Obamacare holds strong for the moment. At this point, the Trump administration was unable to successfully repeal and replace Obamacare. Republican Senators Susan Collins, John McCain, and Lisa Murkowski voted against both the AHCA and the Graham-Cassidy bill, leaving Obamacare intact. HIV-positive patients in America owe a great deal to these senators, as they are still able to purchase reasonably priced healthcare packages due to the pre-existing conditions non-discrimination policy. They're able to stay on their parents' healthcare until age 26, and they have greater access to Medicaid. As of April 2018, the Affordable Care Act remains intact and the HIV-positive community continues to benefit. Thank you for listening to our presentation, and I hope you learned a lot about Obamacare, the repeal and replace process, and its effect on the HIV community. Next time a major headline speaks of replacing the Affordable Care Act, I hope you keep in mind individuals with HIV.